Welcome to the press briefing. With us today are Dr. Zhang Chokwan, Head of Communicable Disease Branch of Center for Health Protection, and Dr. Lau Kwan Hin, Chief Manager from Hospital Authority. The two doctors will give us an update of HA and also the case situation. Dr. Lau, good afternoon. Now I will update you on the situation with HA. We have 1,473 confirmed patients. 230 of them are newly confirmed cases. We have 1,157 patients in isolation facilities. Of them, 516 are in isolation wards, 90 in second-tier isolation wards, 551 in Infection Control Center of North Lantau Hospital. Among the 1,157 patients, 183 are newly confirmed patients. Yesterday, two patients were newly reported to be critical and 6 in serious condition. Of the inpatients, we have 29 in critical condition, 29 in serious condition. 9 critical patients are receiving treatment in ICU. Now I'd like to talk about the case of a small boy in Princess Margaret Hospital. We have a new case of a critical condition involving a boy, 2 years, 3 months old, and yet to be vaccinated. Last Friday, i.e. on the 12th of August, he started to develop a fever and with flu symptoms. And then in the small hours of this morning, he started to have shortness of breath and also croup. And then his family took him to an A&E department. And after testing, the CT value was 14.8, a rather high viral load, because his difficulty in breathing continued to worsen, and then he presented with croup, and intubation was required to assess his breathing. He is now in the pediatric ICU of Princess Margaret Hospital in critical condition. Our medical staff are closely monitoring his situation to provide him with appropriate treatment. I'd like to report to you the girl, 5 years, 9 months old, staying in Tuen Mun Hospital. She is still in critical condition and receiving treatment in PICU, and we will provide appropriate treatment based on her circumstances. As for her 11-year-old elder sister, she is also confirmed and being treated in Tuen Mun Hospital pediatrics ward. We appeal to parents once again, do not hesitate. Take your children to get vaccinated to enhance protection as soon as possible. Vaccination against COVID-19 is the most effective way to prevent serious conditions and fatalities. According to experts, with vaccination, the possibility of having croup or encephalopathy will be greatly reduced. In the last day, another 132 patients recovered. 104 of them have been discharged. I've missed out another case. Now, 4 more cases of death have been reported, all male, aged between 63 and 91. All staying with families. None of them have not been fully vaccinated. That is, they have not received 3 shots of vaccines. One younger case, aged 63 male. This is a 63-year-old male. On the 7th of August, was tested positive by RAT. There's no record of his consulting our designated clinic or taking anti-COVID oral medicine. On the 13th of August, he tested negative again through RAT. However, in the early morning of the 14th, he complained of chest pain to his family, and then his condition continued to deteriorate, and he had lost consciousness, and they called the ambulance, which took him to the A&E department of Northern Hospital. On arrival, resuscitation was administered, his heartbeat resumed, and then our PCR yielded a CT value of 22.8, so he was admitted to an isolation ward, but then his condition continued to deteriorate, and then his heart stopped again, and then he passed away because the development was very rapid. On the 13th of August, because he had not seek any medical help, so we did not know what was the cause. Was it really related to COVID-19, or was it because of a heart condition? So the case is referred to the coroners for an investigation. Nevertheless, because this is a patient over 60 years old, we encourage all who's over 60 and tested positive, even though they may have very mild symptoms, just mild fatigue, mild sore throat, cough, and runny nose, they should seek medical help as soon as possible. No matter whether someone over 15 has been vaccinated or not, new COVID oral drug would be prescribed. In particular, if someone is not vaccinated at all, even though he may have no symptom, we encourage him to go and see a doctor. He can attend a designated clinic, or we can give him medical consultation. So after ascertaining his condition, oral antiviral drug can be prescribed to reduce the possibility of hospitalization or serious conditions. So 132 patients have recovered. Of them, 106 have been discharged. 9 patients were confirmed via admission screening or regular surveillance. And then 13 patients in the same ward are classified as close contacts. For staff, we have got another 99 staff members confirmed, and 36 colleagues have returned to their duties. So far, we have 1,100 staff members who are either confirmed or close contacts that are not able to return to their duties. About 680 odd of them are confirmed cases. The hospital authority has always reminded our staff to be vigilant, in particular when we are in a rising trend of the epidemic. We hope our colleagues can protect themselves properly and observe all preventive measures. Public hospitals have enhanced testing of staff members. All members of staff are required to administer RAT every day, and for those who are at high-risk positions, such as working in oncology work, A&E department, and renal wards, they have to do two extra PCR tests per week, so that possible confirmed cases can be identified as possible to protect our patients and staff. And staff members are expected to take preventive measures to protect themselves and to alleviate manpower shortage in HA.
As I've mentioned, we have some 1,700 or 1,783 patients in hospitals. Some 200 of them are new patients. The situation is still at a high level. The new admission to hospital today numbered at 230 today. We are worried that the higher admission number would bring about a pressure to the public healthcare system. Non-emergency services would inevitably be affected or further truncated. Now we are at a second stage at the second stage of our beds deployment program. If the situation further worsens, we will activate the third phase of the program. By then, 2,500 to 5,000 beds will be reserved to take in COVID-19 patients. When necessary, we will reactivate the AWE COVID Treatment Center, which is now on standby to take in new patients. And we will also coordinate isolation facilities and respite facilities to share the burden. Now, in terms of manpower situation, we have mentioned that we now have a real name roster so that we can more flexibly deploy manpower to take care of patients. We would like to remind the public again, if you are not vaccinated, please do so as soon as possible, and also take the preventive measures in your daily life. Maybe you would find me repetitive because I have been urging the public to get vaccinated. Still, we have observed that a lot of the diseased patients have not completed the whole 3-dose courses. Now, some patients had 1 or 2 doses and then stopped there. Now, after the first or the second dose, if you have no adverse symptoms, you should get the third dose as well. If you are not vaccinated at all, then you have zero protection against COVID. So we are really urging the public, if you are not vaccinated at all, please make haste and get vaccinated. If you have had 1 or 2 doses, please get the third dose promptly. For children, we have seen more cases and more severe patients. Now, 2 weeks ago, we have lowered the vaccination age to 6 months old. Now, for those above 3, the vaccination program has begun already. So let's take the opportunity and get the children vaccinated. Now, Sinovac vaccines are available for children. According to the experts, it will greatly boost the immunity of children and greatly reduce the risk of complications or even deaths brought about by COVID. So concerning the impact on non-emergent services, if we can reduce the number of hospital admissions, we can maximize the amount of emergency services available. However, if we have more hospital admissions daily, maybe 200 or 300, then naturally the non-emergent services would be affected and treatments would be delayed for those patients. But if that really happened, I ask for the public's understanding. Let's work together and emerge from this wave. Thank you. Good afternoon. Yesterday, we have recorded 4,699 local positive cases, including 1,594 PCR positive cases, and the remaining are confirmed RAT cases. And also 197 cases were imported, including 165 confirmed via RAT, PCR, and also 32 RAT positive. Among the 197 imported cases, 98 were tested positive at the airport. And also during the first three hotel quarantine days, first 3 days of hotel quarantines plus family members, there are 54. These cases, there are 33 cases found at the community testing centers during the 4 to 7 days of medical surveillance, and also 12 positive cases with high city value. Now we have 33 cases found during the 4th to 7th surveillance day. So taking away the cases on the 7th day, the percentage between the 4th to 7th day is less than 20%. That is within the expectation, and those are people with amber code. Now, the 197 cases are from 39 places, with 7 places imported more than 10 cases. India 29, UK 21, the US 14, Canada 14, Thailand 13, the Philippines and Singapore 12 each, and the remaining 32 cases have imported less than 10 cases. For residential care homes, we have 3 care homes with cases with people quarantined. Hong Kong Chinese Christian Yihong Tianping care home with 3 infection-free quarantine. Now, 6 Yuan Hong An care home at Kwai Chung with 1 infection. 1 infected resident and 1 resident quarantine. Dak Fuk elderly care home, 1 staff member infected, 2 residents quarantined. Schools, today is Monday. Many schools are on holiday, so the number is lower today. 110 schools have reported 147 positive cases, including 111 students and 36 teaching staff from 43 kindergarten or childcare center, 29 primary schools, 37 secondary schools, and 4 special schools. 8 schools have reported more than 2 cases in the past 7 days, with 1 school which we have advised to suspend for 1 week. That is Hong Kong Kowloon Gai Fong Women's Association School in Sha Tin Shui Wo Yun, N1 class, 34 students. In the past 7 days, 3 students were infected. We have advised the school to suspend school for 1 week. In terms of the variants, suspected BA.4 or 0.5 strains. According to our laboratory experts, most of the samples carried BA.5, accounting for 23.1% of the total infection, total number of samples. BA.2, 0.1, 2.1, around 8.4%. The remaining samples carried the prevailing strain, that is BA.2.2. Thank you. And now we will open the floor to questions. Please use the microphone that we give you and identify your media organization. The gentleman in blue. I'm from Now TV. Now, how many child patients have a croup, and what is the percentage? Now, the 27-month-old boy with croup, does he carry BA.4 or 0.5? Does he have other illnesses? In the entire family, is it true that only the boy and the sister were infected? Who was the original patient? Now, what about the risk of BA.4, 0.5 to children? Is it more serious than other strains? Did the CHP or the HA have any response strategy against more children infected with BA.4 and 0.5 and hence had more serious symptoms? Now, you said we are going to enter into the 3rd phase of the BATS deployment strategy. So when will we activate the plan?
So far, I don't have statistics on the percentage of cases with croup, but pediatricians from different hospitals have said that they have seen more cases with croup. including inflammation of larynx or bronchus because of COVID. And so they have developed croup. They may need high level of oxygen and even intubation and also medication. So I appeal to the public. If you see that your child might have COVID, and if it has started to breathe more rapidly or with force, and if you hear barking noise, then you should take it to the A&E department as soon as possible, because with inhalation of drugs, we may be able to control its inflammation, so no intubation is required. But if breathing difficulties continue, intubation may be required to assist its breathing. So speed is of essence. And experts have also said that with vaccine protection, the possibility of developing croup as a complication can also be reduced. In this child, 2 family members are also infected, and that is its father and elder sister. And the onset was a few days ago. The elder sister tested positive at around the same time as the child. You mentioned prevention. There are 3 things. First, it may be cliche already, but then we have vaccines available for kids over 6 months already. But for this case, of course, onset was a few days ago, so there was not enough time for it to be inoculated yet. But for healthy kids who are over 6 months, so I hope they can be taken to vaccination as soon as possible. Hopefully, within the following 4 months, they can take 3 jabs to complete vaccination. And if a child is unwell, it should be taken to the A&E department or to see a doctor as soon as possible. Croup is an urgent condition. So if you observe your baby breathing rather forcefully with straining of neck muscles, and that means the child is breathing with difficulty because of inflammation of his windpipe. There is insufficient oxygen intake, so immediate medical attention is needed. Now, I'm not referring to this case in particular, but then if there are high-risk family members living together, such as kids younger than 5 years old, elderly persons over 70 years old, women over 28 weeks of pregnancy, or those who are immunocompromised. They may be taking drugs causing a lower immuno response or with a lower white blood cells. So if there is someone confirmed in the family, that patient should be isolated as soon as possible to reduce the chance of passing the disease to high-risk family members. As for bed deployment in the 3rd stage, now we are talking about this morning because we have observed a rising trend in the number of inpatients. Today is 1,700. A couple of weeks ago when I was here, the number was around 1,400. And the number of new cases is also rising. Today is 230. And we have 180 of them living or staying in isolation wards. So we have to be prepared. As mentioned by Dr. Zhuang, as we have more BA.4.5 cases, which are more infectious, we are worried that there will be more cases. And we can expect a higher proportion of cases requiring hospitalization and even intensive care. So we have to be prepared when the number of inpatients increases. We have to convert some of our beds to COVID patients. For instance, in our ICC, Northland Hospital, and also AWE COVID Treatment Center, we have to be prepared. As regards the number of beds to be adjusted, well, we have to be flexible depending on the circumstances. The principle is not to affect non-essential services as far as possible. But as you know, we have just this number of beds. If we have to reserve beds for taking COVID patients, inevitably non-essential services on non-urgent services will be affected. So we want the public to know our preparation, and when non-urgent service is affected, we ask for the community's understanding. As the number of cases rises rapidly, I hope we can all do our part. We should all get the third jab, and also to step up preventive measures to lower the chance of infection. We should not bring back the disease back home where we may have high-risk family members, and to reduce the possibility of hospitalization and deterioration. Let me supplement. A confirmed case may think that he has been fully vaccinated and his symptoms are mild, and he wants to stay home for isolation instead of going to a community isolation facility. But if there are high-risk family members at home, a child under 5, someone over 70, or a pregnant lady, or a family member with immunocompromised condition, then if they are infected, the chance of death or serious condition is high. In particular, some kids have yet to have the opportunity to be vaccinated. I hope these confirmed cases can consider going to a community isolation center to protect their family members, to avoid the possibility of getting serious symptoms. Now, for the 5-year-old child who has got encephalitis, the genome analysis L452R, that is the prevalent strain in Hong Kong. Next. Good afternoon. I'm from TVB. Just now, we're told that the elder sister of the 5-year-old girl is also positive and is being treated in a pediatric ward. Has she been vaccinated? And for the 27-month baby, is he vaccinated or not? Because his father and elder sister are also infected. The 5-year-old patient in Two Mun Hospital, his elder sister is 11 years old and has received 2 jabs. The boy, the 27-month-old boy, hang on. His father has been vaccinated, but his sister not. The sister is 5-year-old. So I continue to appeal to the public. Well, vaccination is available at different places. Our general outpatient clinics and GPs, and also vaccination center and hospitals can also provide vaccination. So please get vaccinated, receive all 3 jabs as soon as possible.
The lady at the back. Good afternoon. I'm from cable TV. The 27-month-old in ICU. Is he still in a critical condition, and is his life in danger? And what about the trend? But how much did by how much did the number of infants or children admitted into ITU has risen? Is it because of the lack of vaccination or otherwise? Now, the 27-month-old boy is still in a critical condition. Our team is caring for him and monitoring his situation. And there have been more young children infected. The reason is that we have more infections in the community. So when the young children go out, they may be infected, and also their family members may bring the virus back home and cause infection. As a result, the number of young children infected has risen. In terms of the ICU admission of children, we would tell you almost every case of ICU admission. So luckily, we don't see a spike of children admitted into ICU, but in just the past 2 days, we have seen two ICU children, pediatric patients. That is the 5-year-old girl and the 27-month-old boy today. So you should get vaccinated and see a doctor promptly when you feel unwell. And if your family members are infected, the patients should be isolated to minimize the risk of infecting your young at home. The lady over there, I'm from Orange News. Now, about the deaths among the deceased patients today, did they have chronic illnesses? 3 patients did not complete the 3-dose course, but what about the other one? Now, the 63-year-old deceased male, besides that patient, did the other 3 seek medical assistance at designated clinics, and did they take oral drugs? Now, what is the risk of having a croup after children infected with COVID? What is the fatality of having croup? Now, for the CHP, Professor Lau Yulong said that before August, the BA.4 strain would become the prevailing strain. So how will it affect the situation in Hong Kong? Will we see an exponential increase of number because of the higher transmissibility? Now, suspected BA.4 or 0.5 cases, according to our laboratory experts, most suspected BA.4 or 0.5 cases are actually BA.5 cases in Hong Kong. Now, this is in line with the global trend. According to the WHO and other places, statistics, BA.5 is the prevailing strain. Hong Kong is no exception. We are on a rising trend. We are concerned about the additional stress on the public healthcare system. So like Dr. Lau said, we should get vaccinated, see a doctor, and also report your status promptly and get early treatment. If necessary, you should be isolated. Sorry, I missed out the details of other disease patients. One of them was 79 years old with 3 doses. He had a number of chronic illnesses, including diabetes, hypertension, high blood, high lipid, and also heart problems, as well as a stroke, and also a decreased renal function. Now, on the 4th of August, he tested positive on RAT and went to A&ED. PCR was positive, CT value 17. In hospital, he was given oral antiviral drugs. He was an elderly patient with a number of chronic illnesses. Unfortunately, he passed away yesterday. The 2 other patients were 91-year-old males with chronic illnesses. One of them had lung cancer, which has metastasized to different organs. So his that may not be directly linked with COVID. He passed away at the convalescence ward. The other one at the hospice department. The other one was also a 91-year-old male with diabetes and diminished renal function and high blood lipid. Now, he had 2 doses, tested positive on the 7th and admitted to hospital, and then deteriorated quickly and passed away yesterday. These 3 patients have been prescribed with oral or injected antiviral drugs. Now, croup, you have to understand that for croup, the respiratory system, and mainly the throat, the windpipe, and the trachea are expanded because of inflammation, and then it would cause difficulty of breathing, and a serious condition would cause a suffocation. If croup is not treated, then the fatality is high. However, croup, if treated early with a proper medication, it would alleviate the inflammation with a steroid and adrenaline, so that the nearly obstructed or completely obstructed trachea would be unblocked, and airflow can resume. For very serious cases, there may be no sound at all. For some cases, there may be hissing or barking noises, but the most serious cases would not do not come with sound because there is no airflow at all. So if a normally active child suddenly becomes quiet or tired with rapid breathing or difficult breathing, or even with sounds like hissing and noises, you should take the child to see a doctor promptly. The gentleman over there, hi, AM730, the 63 deceased male, did he report his status? He tested positive on RAT and then PCR positive on admission. Now, is it because of a low CD value or other problems? Now, you urge those unvaccinated people above age 60 see a doctor. So is it a policy to prescribe oral drug to people with symptoms? And about the 3rd stage of bad deployments, at what stage will you activate the plan? How many admission would trigger this stage? And also, would you alert the patients who would be affected in advance? Now, you said some confirmed patients are unwilling to leave their home after infection. So do we have a lot of these cases? Some parents are worried that no one can take care of the children at home or the elderly charge at home. So what should they do? Now, many people may think that it would be fine if they just isolate at home, but they have to consider the family member status. Maybe the patients are vaccinated and have mild symptoms only, but there is a risk that they would infect the high-risk people at home. So if these factors exist, these are high-risk factors, and the patients should be isolated at community isolation center to protect the family members. I have no information about the reporting status of the 63-year-old deceased male. On the 7th of August, was probably made aware to us by the family members that the patients tested positive on the 13th. So the screening will be performed for all patients being admitted to hospital. CD value was some 22. Now, the admission was on the 14th, so there might still be some remnant in the body. So I'm not sure whether the virus in his body was inactive or active. There was a positive RAT and there was a test at the hospital with a CT value of 22. The major complaints of the admission was chest pain and unconsciousness. ECG and other checks were performed. It seems that it was a coronary issue with high, because he had high white blood cell count. Maybe it is because of the COVID complication or other infection or coronary heart disease. We're not sure, so we have referred the case to the coroner for investigation.
We encourage COVID patients over 60 to see a doctor because the patients may not know whether they are not well or not. Doctors usually know what are the usual symptoms and under what circumstances should drugs be prescribed to minimize the possibility of deterioration. Are we going to administer drugs even with no symptom? Well, the symptom can be as mild as fatigue. It can be one of the symptoms. We want those in particular who have not been vaccinated. Now, even for those who are vaccinated, but for the former, they have no protection. And if the disease develops very quickly, then the possibility of turning to a critical condition. So for those who are over 60 and unvaccinated, in the unfortunate event of having contracted COVID, do remember to see our designated clinics as soon as possible or book a medical consultation using our HA Go mobile app. And if they don't know what to do, they can call our hotline 1-833-6115, and then they can tell our medical staff online their conditions. And we can even arrange for the patient a telemedical consultation. We have 230 cases today. We expect the number to continue to rise. From 230 onwards, we have to think of the third phase. As said before, when we were receiving 200, 300 cases, we had to consider when to start phase 3 of our preparation. This is about how to make beds available. That means we have to adjust services, non-urgent services such as non-elective operations. For instance, removal of bile, and of course, if there's suddenly inflammation of the bile, and this is an urgent operation, but it may be an endoscopy, and for cancer cases, of course, they are urgent cases. It is hard for us to give you an exhaustive list of urgent or non-urgent cases, but doctors will, based on the circumstances, and decide whether a certain case can wait for another couple of weeks. For non-urgent cases, we want to delay the operations for a while to reduce the number of inpatients so that we can have more beds available for receiving COVID patients. That is our preparation. After all, we don't know how rapid can BA4 or 5 develops. According to overseas experience, once the percentage of case has gone beyond 20%, the rise can be very rapid. So we have to be prepared and make available beds to receive COVID patients. Next, I'm from HKO1. First, now for imported cases, 33 cases were identified in between days of 4 to 7. I'd like to know the CT value of these cases. While we have more young kids infected, parents are still waiting to see whether they want to get their children vaccinated, because right now only Sinovac is available to them. When can BioNTech be available to them? Now, I don't have the CT value of all the cases with me, but I believe most of them are lower than 30. I understand that colleagues are very proactively procuring vaccines, and that is the child mode BioNTech vaccine. For the 2-year-old boy, I'd like to know whether he was healthy previously. When was his father confirmed? And before this hospitalization, or was he ever tested? And I'd like to have a breakdown of the age of the 230 newly admitted patients. And have you seen a rising number of young patients? If so, the percentage, and what is the utilization rate of pediatric wards? Have they been saturated? Now, in the past half month, the number of cases have been hovering around 4,000 cases. The rising number of child admission cases, is it because of the prevalence of BA.4.5? Does BA.4.5 attack children in particular? And do you have the number of patients transferred to private hospitals? For the 63-year-old man who died, has he got any underlying diseases? The number of confirmed cases. Now, for those under 3 years old, the last couple of weeks have seen a slight increase compared with 2 weeks before. It used to be 1.5%, now it's 1.8%. For the age group 3 to 9, 5.5% remains the same. And whether we have more inpatient cases of children, I think Dr. Lau would check for us. Is it related to BA.4.5? Now we have seen more BA.5 cases is over 20%, so 1 out of every 4 or 5. Yet not all cases are BA.4 or 5. 4 or 3 cases out of 5 are the current prevalent strain. Of course, if you have not been vaccinated and not positive before, your immunity is limited. And for adults, because they've been vaccinated before, and that may be related to the vaccination rate and also their infection rate. So it's important to get vaccinated. All right, one by one. The boy was in good health. He hasn't had any major diseases. The father, on the 9th of August, he tested positive through RAT11, positive by PCR. The elder sister tested positive by RAT on the 13th, and then positive by PCR on the 14th. The age groups. Most of the newly admitted patients are elderly persons. 158 of them are over 60 years old as at the 14th of August. For the remaining cases, there is no obvious difference in terms of the age, but we have seen more elderly persons admitted. That's true.
Pediatric patients. The number of, the situation of pediatric ward beds, the situation is tense because there are more young patients. So we'll continue to increase the number of beds for pediatric wards. So when there are more children, child patients, we will open up more beds for children to admit them for treatment. Concerning private hospitals, at the moment, as at the 14th of August, there were 117 patients receiving treatments in private hospitals. Among them, 16 are being treated as the Chinese University Hospital or Chinese University Medical Center. Now, the 63-year-old deceased patient, he had tuberculosis and chest pain, and then orthopedics conditions, including fractures, which were not related to COVID. So tuberculosis, chest unwell back in year 2017, mild high blood pressure for the lungs. The last question, please, the lady over there. Good afternoon, doctors. I'm from Ming Pao Daily. Now, critical pediatric patients, the 27-month-old boy, what strain does he carry? And also the Two Moon Hospital girl, is there a genome sequencing results for the virus? And what about the family members? And what is the route of transmission? Now, what is the age of the elder sister of the 27-month-old boy? Now, what schools do they study in? Is there an outbreak, and is it the case that they got infected in school? Now, during the school holidays, teaching staff and students are no longer subject to RAT. So are you worried that we will see more critical pediatric patients because of that? Now, there is one more serious child patient aged between 3 and 11 years old announced by the HA. So is there more information about that case? That should be the 5-year-old case. Now, the requirements of the daily RAT for teaching staff and students is to avoid an outbreak at school. Now, if the children are staying at home, if the family members are infected, and if they feel unwell, of course, they should also do RAT just like other citizens. And they can also get a test at the community testing centers. Normally, patients in the same family would carry the same variant for the same antigen. Now, I don't have the genome sequencing results of the child because he was rushed to the Yanchai Hospital in the small hours today. The RAT was positive, and the PCR sample was taken then, so I don't have the results of the test yet. Concerning the elder sister, well, maybe 4 or 5 years old, around that age, the situation of the elder sister is stable. The press conference now ends. Thank you very much.